Well, as the Delta variant continues to spread, the World Health Organization and LA County recommend that vaccinated people should start wearing masks indoors. We're joined now by Dr. Richard Besser, Robert Wood Johnson Foundation President and CEO, and former acting director of the CDC. So, Dr. Besser, we keep hearing that vaccinated people have protections against the Delta variant and also that mutation, the Delta Plus mutation. So why is there a need for masks?
Well, I think in places where vaccination rates are low and where the number of cases is going up, wearing masks is a tool that public health departments have to say we're gonna increase the things that we're doing to try and control spread. For people who are fully vaccinated, I think it's quite safe to be out and about without a mask on. Unless you're someone who has an underlying medical condition where a vaccine may not have been so effective. When the World Health Organization is looking out around the globe, they see a world in which most people have not had access to vaccination. And so thinking about recommendations for the globe, saying that people should wear a mask indoors makes a lot of sense. We, as one of the wealthiest nations on the planet, have a lot more that we need to do to help ensure that vaccines are reaching people everywhere, here across the United States, as well as around the globe.
I'm sure you've seen the news, Doctor, that a lot of vaccine sites are actually closing now, and some of those pop-up vaccine sites are closing down. And I don't know whether or not to think of that as a good thing or a bad thing. Does it mean that we've topped out and those who are not vaccinated yet are just not going to get vaccinated, or are we very close to that herd immunity now?
Well, I don't think it's either of those. We haven't topped out. There's still a lot of people who haven't been vaccinated and need to get vaccinated. There are a lot of people who want to get vaccinated. There are people with disabilities who are homebound. And when you think about mega vaccine sites, their needs aren't being met by that. There are people in communities who don't have the transportation to get to mega vaccine sites. So if you think about the way forward for where we are to increasing the numbers, it's a very different approach that's needed. So many people have trust in their own personal healthcare providers, their doctors, their nurses. Providing vaccines at those locations where people are used to getting care, at their local pharmacies as well, that can go far to increasing trust, getting people's questions answered, and hopefully continuing the slow increase in vaccination around the country. In terms of resources, staffing and providing vaccines to mega sites, it only makes sense when you've got increased demand, much higher demand than we currently have. We should be able to meet the demand through other mechanisms and hopefully take some of those resources that have gone to fund these mega sites and use them into more direct outreach to meet people where they are.
So, Doctor, going forward, what guidelines do you anticipate will be or perhaps should be put in place, particularly for those people that are not yet vaccinated, for attending things like Broadway plays or going to sporting events? Do we need to maintain constant testing that is checked as a potential sign for entry into some of these events if you are unvaccinated?
I think a lot depends on what's going on in the community in terms of COVID transmission and health resources. So if you're in a community where the amount of COVID that's circulating, that's transmitting is extremely low, where hospital resources are not being taxed by taking care of patients with COVID, where the positive rate of testing is really, really low, then you're going to take one approach. You're not going to need to require testing for people to come to events. You're not going to need to have the same kind of enforcement that you would want to see in a community where the cases are rising, where hospitals are being stretched, and you're seeing ongoing transmission. So it's not a one-size-fits-all situation. When you look at the map for COVID across our nation, if you zoom out, it looks incredibly good. It looks like we have this totally under control. And if you look at the number of cases, they're holding steady at around 10,000 per day. But if you zoom into that map you're showing, and go down to the county level, you're going to find some counties where the numbers don't look good at all, where they're really still seeing a lot of transmission. And in those places, you want to make sure that the local officials are taking a different approach, that they're putting in place more precautions, that they're scaling up the accessibility to vaccination, and letting people know that this Delta variant will transmit easier. And so people who aren't vaccinated, people who haven't had COVID before, are at increased risk. Thankfully, in America, one of the things that we see is that the highest vaccination coverage rates are among those who are the oldest and those who are at the greatest risk for severe disease. So that gives a little level of comfort that even with increased transmission of this Delta variant, that we won't see the same kind of spikes, the same kind of pressure in terms of hospitalization and deaths that we've seen with increasing case rates earlier in the pandemic.
Dr. Besser, how much is COVID-19 still a threat for young folks? And I mean those under 12 who have not yet been able to get vaccinated. I know that 2%, I think it is, of all COVID-19 hospitalizations are children. That seems relatively low to me. And how important is it that that subset get vaccinated?
Yeah, I'm a pediatrician, and it depends what you think about in terms of numbers and burden of disease. Thankfully, childhood is not a time where you tend to see a lot of mortality. It's a time for future and for dreaming. And so when you look at the numbers and you see only several hundred children have died from COVID, you can look at that and say, wow, compared to adults, that number is really small. But when you look at overall deaths in children from a wide range of things, I look at that number and say everything we can do to prevent a childhood death is really, really important to do. So the good news about COVID is that it's less severe in children, much lower rates of hospitalization and death. There's still a lot that's not known in terms of long COVID, in terms of symptoms that continue over a long period of time. So I don't want to diminish the importance of it, but it is, I think, comforting that children tend to do much better with this infection than adults do.
All right, we'll have to leave that there. Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation and former acting director of the CDC, thanks so much for joining us today.